Hello, hi, this is Dr. Erica coming back with another video to talk about heart failure medication. Heart failure medication in particular, Aprazolin and Lanoxin or Digoxin, also known as Digitex. So these particular medications are for patients who have stage C or the third stage failure, and they have fluid retention and no improvement in their actual blood pressure or hypertension symptoms. So then we want to go further after the ACE inhibitor, after the ARB, after the uh, thiazide diuretic. We want to go a little bit further, be more aggressive with therapy. So we're going to introduce other classes of medications that lower blood pressure through a different mechanism of action. So that is the endpoint at this particular stage. Stage C. Stage C is when a patient has structural abnormalities in the heart. The structure of the heart is changing. There's fluid being reserved in the ventricles. There may also be a spark or SA and AV node spark distribution change that could alter the rhythm of the heart, alter the rate of the heart as well. So we want to add also the beta blocker, as well as the ACE inhibitor, as well as a thiazide diuretic. And then again, with more aggressive therapy, we're going to talk about the Aprazolin or hydralazine, and then the digitoxin or digoxin or the Lanoxin as well. So that's where we're going to see these particular two medications. There are also some other specific medications to add on, so many other classes for each stage of heart failure. I might also mention a little bit about amiodarone or Pacerone. It's a common medication used for arrhythmia patients who have attempted other classes of medications and then need further treatments. Okay, so hydralazine is a medication to lower blood pressure, essential blood pressure. Is usually added on after digoxin. So I'll go over digoxin first. Digoxin is a medication that is specific for patients who have arrhythmia, a flutter, change in heart rate, patients who have again, going through so many other medication classes and still need that additional boost. So patients who have heart failure will usually get a digoxin on board in stage C. Okay, usually it's going to start off with a very low dose of 0.125 milligram to 0.5 milligram in a single dose per day. And that's very small. So the patient is going to get tablets. Usually it comes in capsules, it comes in IV, it comes in an elixir as well. So there are a variety of formulations just in case there's need in the hospital, etc., pediatric patients, etc. Okay, so some of the side effects are going to be like aflutter and AFib are going to be some of the side effects just because that's where the medication is going to be working. Also vomiting, also anorexia, blurred vision, headache, and nausea, and gynecomastia as well, dealing with the gynecology form of some sort. But in general, patients will deal with headache, bradycardia or slow heart rate, nausea, and anorexia. Okay, now it's safe to take in pregnancy patients as well. Those who have renal dysfunction, a lower dose or use with caution. Also, it's contraindicated in patients who have a ventricular fibrillation. This is for the medical students out there who are listening. This is for the pharmacy students who are going to go into clinical services later on, PGY. 1 and 2. So do understand that digoxin is not for patients who have a ventricular afibrillation. Okay, so the patient should already be in a more steady or more controlled rate before they receive digoxin. Okay, also, drug interactions are very large. I'm not going to go through all of them, but just know that there are so many different drug interactions with other heart failure medications. Okay, um, to name a few, I'll just say diuretics. Also, patients who are taking cholesterol medications, those patients who are taking penicillin, you want to also be cautious as well. Now, do not take any non-prescribed cough, over-the-counter flu medications while taking digoxin, just because this medication does interact on the heart, and we don't want to have that side effect of the medication adversely working with other medications. Okay, so it has side effects and drug interactions, so we want to be careful with that. Also, laxatives and acids of that sort should be first introduced to the doctor to let them confirm the use is okay. Again, that's going to be your laxatives and acids. Anything over the counter, make sure that it's approved by the physician first, just because we want to make sure that um, we're not over medicating and we're not causing more and more drug interactions at this particular point. If a dose is missed, take it as soon as possible. If it's so close to the next dose, then you want to skip it altogether and then go ahead with the regular scheduling, just because we don't want to double up on digoxin medication, causing more changes in heart rate, heart blood pressure, and so forth. Okay. So that's all that I have for the digoxin medication, and it comes in different formulations for convenience to the healthcare providers. This medication, I've studied it before, and patients that or customers that patients I've come to know throughout my pharmacy school years, and it's very effective, and patients are aware of the side effects and things and are very compliant, because without compliance and adherence, then there's a chance for greater adversities. So people are very compliant with them. They're very much refilled on time. I never had anyone say, well, I don't want to take this medication anymore. I'm not going to refill it. I want to stop taking it. No time have I ever experienced someone saying that. It's just the fact that patients will know that it's very important to take. Okay, and we'll do accordingly. So the next medication I'm going to go over is hydralazine or prazolam. Prazolam is a medication that is mainly dosed for essential hypertension in patients. It's going to be dosed 4 times a day, which is very frequent up until the time that the patient is under a little bit more control. Then the patient may be dosed down, or they may be dosed maybe twice a day instead of 4 times a day instead. Okay, it comes in different strengths of the tablet formulation, and it is a medication that changes the calcium influx, the calcium concentration in and out of cells of the heart. That's how it's usually going to work, and it causes a relaxation of vascular smooth muscles, arterioles more so than veins. Going to give that a little bit more smoother flow of blood through the arteries and less resistance, less backing, things like that. So metabolism occurs in the liver. So patients who have liver disease, liver function, do use with caution. Patients who have urinary problems, those patients who have kidney issues, reduction in function of the kidneys, do use caution, because this medication is going to work with the liver as well as the kidneys for excretion. Side effects: nausea, vomiting, diarrhea, and headache. Also, because it works on the heart, again, we're going to expect some side effects such as bradycardia, tachycardia, fast heart rate, also chest pains, angina, things like that. Take with the food, take with the meal for best absorption through the GI tract. Also, there's a large, um, no real contraindication except those who have hypersensitivity or coronary artery disease. Also, those who have a valvular heart disease, rheumatic heart disease, is contraindicated to use this particular medication. If you have lupus, do let your doctor know. If you develop lupus while taking the medication, it's very important that you report this type of symptoms that's related to lupus, which is going to be like the itching, the hypersensitivity reaction, could be organ pain at the different organ sites, because lupus is a immune system based disease, and hydralazine is known to have some effect, some relationship with lupus. So do be aware of that. Also, now, if you feel headache, side effects like anorexia, those are some side effects as well. I didn't mention, but headache, anorexia, again, heart problems, diarrhea as well, nausea and vomiting. The GI tract usually is what's going to affect this medication. Also, if you miss a dose, take it as soon as possible. But if it's so close to the next dose, then you want to skip it and start to your regular schedule. So do be aware of that as well. Okay. And it is pregnancy category C, which is meaning it's okay to take if the physician feels that's appropriate. Okay. Um, if peripheral neuritis is observed, peripheral neuritis, inflammation of the neurons, the doctor may need to start to add a different medication to help offset that particular side effect or progression. Okay, and it usually peaks at about 1 hour to 2 hours. So it is going to, once it peaks, then the half-life will be shortly after, and then that's why it's dosed 4 times a day usually. Half-life of 3 hours to 7 hours. So yes, it's going to be dosed more frequently throughout the day. So do be aware of that as well. Amiodarone. I'll go over amiodarone very briefly. I can add some more information in the description box for you. It is a medication for arrhythmia, particularly for patients who have ventricular fibrillation and unstable ventricular tachycardia, and who are unresponsible or who cannot tolerate other antiarrhythmic agents. Okay, now it is maintenance dose of 400 milligrams per day. It comes in injection for those who are in the hospital, and it comes in tablet formulation as well. Again, at 400 milligrams a day. Loading doses are usually given over first 10 minutes and then follow with the slow infusion. So patients who are initiated on amiodarone, they're usually going to be started in the hospital first. So the patient comes into the hospital for appointment, and then they're going to get started on the medication as an IV, as a loading dose for those medical students out there, for those pharmacy clinical students out there. They're going to get a loading dose in the hospital, and then after they're stable, they're going to go home on tablet formulation, okay, to resume therapy at that point. So do be aware of that. The brand name is Pacerone or Cordarone, and this medication is contraindicated in patients who have cardiac shock, bradycardia, second and third blockade, and also unless the patient is on a pacemaker, then they can take this particular medication. Okay, so it can be used with patients who have pacemakers and are qualified. Okay, it has a large, long QTC prolongation. Those patients should be using this with caution. It's not to be used in those who are pregnant It has a pregnancy category of X. So that means no way that a pregnant patient, should be taking this particular medication. There are other classes, other medications such as the digoxin that I mentioned, that can be used instead. Also, side effects may be hypotension, shock, also congestive heart failure, cardiac arrest, AV block, photosensitivity, fatigue, anorexia, visual disturbances. The list goes on and on. Liver dysfunction tests, abnormalities. So do be aware, if you're started on amiodarone or paclitaxel, your doctors will go over the medication with you before being released from the hospital. But they will go over that medication with you, and you'll have a team of cardiologists to help with that as well. Okay. Some of the consultations that tips that a pharmacist will give you is that you should refrain from sunlight exposure, overexposure. Also, avoid grapefruit juices as well. If you miss a dose, then don't double up. Continue with your regular dose. Don't try to take the missed dose. Just go ahead with the normal schedule. Miss that dose and go ahead with the normal schedule, and let your doctor know that you did miss a dose so they can make documentations for your profile. Also, overexposure to sunlight? You don't want to do that as well. In regards to meal, preferably with the meal, taking consistently. If you're going to take it with the meal, just do consistently. If you're not going to take it with the meal, then do that consistently, is what I'm getting at with this particular medication. And again, store in a cool, dry place, not for pregnancy patients at all. Do be aware of that as well. Some of the mechanism by which it works is that it's going to work for class 3, those patients' symptoms who have symptoms of heart failure, and then they also have rest only when they're not actually working, or they're not actually performing daily activities. Again, this particular medication is for those who do not have comfort when doing their daily activities. They have to be resting in order to feel comfortable. They have to be in a resting position, and also the patient does have heart failure symptoms. So do be aware of that. I would recommend this medication for someone who's very seriously dealing with heart failure, and who have had no changes in hypertension, no changes in heart rate, heart rhythm, even though they've been on a beta blocker, they've been on ACE inhibitor, they've been on thiazide diuretics. Then, after no relief still of symptoms, the patient is going to be placed on a digoxin or hydralazine or amiodarone or some other class if they're contraindicated. Okay, so do be aware of that. I'm glad to be able to go over these particular medication classes. And if you have any questions, please let me know. I'm Dr. Erica, pharmacist, owner and founder of Millennium Pharmacy. Please visit my website as well. Thank you for joining me. I hope to see you on the next video. Goodbye.